Hi, everyone, and welcome to today's webinar, The Rule Book on Back to School in 2020. During these unprecedented times, we're all trying to navigate the new normal and have so many questions, especially when it comes to children. We are very grateful to have with us Dr. Moses Olorunnisola, and I hope I got it right. I might have butchered it a little bit, but I'm going to call him Dr. Moses to make sure I don't mess it up. But he is a pediatrician from Hackensack Meridian Health Medical Group. He attended undergraduate school at Rutgers University and then went on to medical school at American University of Antigua School of Medicine. He did his pediatric residency at the University of Medicine and Dentistry of New Jersey. He will be discussing tips to stay healthy throughout this school year. So just before he gets started, I just wanted to go over a few logistics. So all lines are muted and the videos are off. If you're on a computer, please make sure your volume is turned up so you can hear the presentation. Also, if you're on a computer and would like to submit a question for the speaker, you can use the Q&A feature that's probably located on the bottom of your screen. We also have the questions that were submitted ahead of time, and we will do questions at the end of the program. If you'd like to make a comment or there's an issue, please use the chat feature. We're hoping for no technical issues, but please bear with us if there are. We will be recording this webinar and we'll send it out after the program if you're interested in listening again or sharing it. It'll also be available on our website. So at this time, I will turn it over to you, Dr. Moses.
Thank you very much, and I appreciate the opportunity to just share some thoughts about getting ready to go back to school during this unprecedented time that we're all facing right now. So yes, my name is Moses, Dr. Moses, like they like to call me. You did a great job pronouncing my last name, by the way. I'll give you an A+ for that. So without taking much time, let's go straight into the topic for today. So the first thing we're going to talk about basically is, preparing for what back to school is going to look like. At this point, a lot of us have already made the decision whether or not you're sending your kids back to school to have in-person learning, or if you've decided to keep it virtual by doing online learning at home. If you haven't made that decision, perhaps after today's webinar, you'll be a little more comfortable figuring out what to do. I think the first thing I'd like to say is, whatever decision you have made or you're looking to make, I don't want us to look at it as a right versus wrong decision. I think more so the better perspective to look at it from is what decision works best for my kids, what decision works best for my family at this time. And whatever decision you choose, I think it's also important to know that there are pros and cons. There are, risks and benefits for each one. And I think having an understanding of those risks, of those benefits, can also play a better role in how we move forward in terms of our decision-making process. In terms of just going to school in person, the obvious benefits to that are being able to, see the teacher, raise up your hands and ask questions and get, education in real time and get answers to your questions in real time. And also the social interaction with other kids, with their peers, things of that nature. It's not the same social interaction that they're used to, but at least it is interaction with their friends nonetheless. And also for children that are younger in the kindergarten to, the elementary school age, they learn best with hands-on, learning and getting to see other kids do things. So those benefits are there. And there are also a lot of families that rely on, the school lunches, the subsidized or free school lunches, so the ability for kids to have access to that by going to school is also a benefit. There are family members that have to go to work, and they're able to work because the kids are at school, so if you are in that situation, having your kids, physically go to school, 5 days a week, even if it's the hybrid model, 2 days on, 3 days off every other week, it gives you that flexibility to be able to get other things done, while your kids are at school. And from a virtual learning standpoint, I think one of the biggest keys for the virtual learning is, there are a lot of kids that have certain chronic conditions, heart disease, lung disease, kidney disease, even cancer. Some kids where being exposed to COVID, may allow them or cause them to have pretty detrimental effects to their health. So being able to still get an education virtually without being exposed to, possible sickness is something that is a benefit for the virtual learning. Um, and I've come across kids, in the office that have pretty severe anxiety about going back to school. So having the benefit of virtual learning until things calm down from an infection standpoint on the outside is also a benefit for virtual learning. I think another thing is it's in terms of routine. Um, I think it's a little easier from having a standard routine because it's Monday through Friday. You know, what schedule you're gonna have, as opposed to the virtual learning, which is one week it's 2 days in school, 3 days in school, online. So by doing it all virtual, one benefit to that is it's a little easier planning your day from a week to week basis. That being said, the flip side to the coin is, for those who are, sending their kids to school, there is that risk of possibly being exposed to, someone who does have the virus or other sicknesses for that matter. It's in the news now. Other states like Atlanta that have opened up, some school districts have already closed after 2 or 3 weeks have been there, just because of maybe a lot of kids being exposed. So that risk is there. The other risk of going to school is, again, back to the scheduling. You could have a kid that's 2 days on, 3 days off, and all of a sudden maybe they were exposed in a class. Maybe the teacher got it or another kid got it. Now you have a situation where your 2 days on and 3 days off turns to a period of 10 days of quarantine at home before you go back to school. In terms of the virtual learning, it may not be appropriate for someone who's in that kindergarten age group. It's hard for a 5 or 6 year old to sit in front of a computer screen all day to learn. And then also focus issues. Kids tend to wonder, or their minds tend to wander easily. So it's a lot harder for certain kids to keep that focus, sitting there on a screen. And being at home in your comfort zone, you can easily get distracted. So I think, again, there's no right or wrong. You just have to look in your personal family situation and try to find out what works best for you. And, on that note, in terms of just making sure you have a plan, making sure you have healthy routines to follow, now is the time to make sure you're fully stocked with enough masks, the pocket size, hand sanitizers, tissues to blow their nose and things like that. Making sure you have all the supplies now before school starts is very important. And then, you talk to your school authorities and find out what school's going to be like. What days are your kid going to go to school? Are they going to be using the school bus versus you driving them to school? So you want to know what your routine is going to be like from a week to week basis, and just help educate your child to say, all right, on this day, this is how it's going to go. I'm going to drive you to school, or you're going to go to school bus, and help them understand that, in some situations they may need to wear their mask, from home if they're going to be gathering around waiting for the school bus, and getting on the school bus. So you want to start practicing those things now, helping them get comfortable, with wearing a mask. You don't want to wait till the first day of school and let that be the first time they're wearing the mask for an extended period of time. You can start doing it now. Have them wear a mask while they're at home, just so you can watch them, making sure they, wear it right and they're not touching their face and things of that sort. So you want to practice what real life is going to be like once, school starts. So it's not, a shock, to the children. And the same thing for virtual learning. There's got to be a routine. You don't want a situation where on Monday you're waking up at 7 a.m. for, virtual learning, and on Tuesday it's 8:30, and you want to make sure you treat it like it is real school. Have a timetable when they wake up, they get ready, and do their virtual learning, have certain time dedicated to that. to that period. And again, you want to start practicing that now. You want to make sure the internet is working, that you have good internet connection, so that you don't have, issues once school starts. And another thing that's very important is, there's a lot of anxiety, a lot of fears, so I think, as parents, as caregivers, it's important to, model positivity and best practices, for your children and older siblings as well, for the younger ones. You don't, you want to be able to wear a mask in front of them and show them that, hey, it's safe to wear a mask. And, we're doing it because we don't want to get germs, and we don't want to share our germs with others. Just make it a positive atmosphere. Try as much as possible to, encourage the kids that, hey, like, this is something that we're doing, to make it safe for others and our friends and our teachers, at school. And it's important to let your kids know what to expect. Whether it's virtual or going to school, you want to help them understand that things are not going to be like they were last year. Maybe in your school district, gym is canceled. So you want to let them know that maybe you're not going to be doing gym. You want to let them know that, hey, like, everyone else is going to be wearing a mask in school. The desk and the chairs may be a little farther apart than normal. And also for virtual learning, you want to help the kids understand that, look, you're not going to be, playing video games at 9 and doing your schoolwork at 10 and, just having a haphazard schedule. Let them know that there's going to be a certain schedule to, the virtual learning, and a certain amount of time dedicated, to doing their schoolwork. So it's a good idea to find out what your plan is going to be or what the school's plan is going to be, and educate your child about that before the time draws near. And going on to the next slide, we get a lot of questions about sports. There are a lot of kids that, sports is part of the school year for them. This may not be a difficult decision whether or not you're playing or not playing in those school districts that have already canceled sports as it is. But for those who still have it, and you're thinking about whether or not you want to send your kids to play sports, I think the first thing you want to do is be educated about what those sports look like. Are my kids going to be told to wear a mask on the field? Is there going to be social distancing enforced? What is it going to look like? Is there going to be, hand washing stations and hand sanitizing stations for kids to clean their hands before and after and during? So getting that information puts you in a better position to see if you're comfortable sending your kid to a situation like that. But I think, again, it's not a matter of yes, send them, or no, don't send them. Just be well informed about, what the school is doing, in terms of making it safe for your kid to play. And then use that information, talk to your child, and make a decision in terms of whether or not you want to send them to play. If you do decide to play, some things to remember are, obviously if your kid is sick with anything from a fever to cough to diarrhea, nausea, vomiting, headache, any symptom, that will, all of these symptoms are certainly worsened when you're overexerting yourself, by playing sports. So if they're sick, certainly have them stay home, recover, see a doctor if necessary, before going back to playing sports. And a lot of sports where, you use equipment like baseball with bats, gloves, hats, things like that. You want to make sure you buy your kids' own equipment. This is not a time where you want to be sharing equipment with other players, or even taking the school's equipment for that matter. You try as much as possible to have your own and make sure your kid keeps their own equipment, and we're not sharing between others. In terms of keeping social distancing, it depends on the sport. It's hard to play soccer, and be socially distant when you're trying to get the ball from the opponent, but during practices and things like that, a lot of the coaches and athletic trainers, have been educated how to keep it safe for all the kids, so it's important, again, to find out what your school is doing and maybe even attend a few practices, to see how, they've made it safe for your children to be able to play and practice. Wearing a mask outdoors gets a little tricky, especially now where it's 80, 85, 90 degrees outside, but there are certain situations where the coaches, and the athletic trainers advise the kids wear a mask, whether it's, when they're in, close proximity to each other, whether it is they're getting instructions from the coaches and things like that. But when it's time to run around and play, because you are outdoors, it's safer to keep, the mask off at that point. But again, the kids will be taking the cue from their coaches and athletic trainers while they're out there during practice. It's important to let your kids know if you don't feel well. Don't try to be, the tough guy. If you're not feeling well, or the tough girl, if you're not feeling well, let the coach know. Let your kids, be open and let the coach know if they're not feeling well so they can, pull them out, seek medical care as necessary. And one thing for both going to school and for sports that I think is important is, have a before and after school routine, in terms of getting ready, making sure they're fully stocked with more than one mask, hand sanitizers and things like that. But when they come back home from sports or school, I think it's important to have them, take their clothes off, put it in the washer, take a shower before they start interacting with everyone at home, because it's the same thing I do. When I go to work, I have two kids, my wife, everyone that's home. When I come back from work, it's the same idea, wash your clothes, go to the shower, make sure you're clean before you start interacting with the family. So I think that's, something that we want to make in terms of best practices for our children as well, especially if there's a family member at home, that has, medical condition that may put them at an increased risk, of having adverse effects if they were to be infected.
Dr.
So
Moses,
yes, ma'am.
I apologize for interrupting you. I think we're having an issue with the slides. Are you advancing them on your end? Because we just still see the title slide.
I am advancing them.
Okay.
So you see just the first page right now?
Yeah, we still see the rule book on back to school.
Okay, let me stop sharing and just try to reshare again. See if that fixes it. Sorry about that, guys. Share screen again. Let me advance. Do you see it now?
Yeah, but it's like 2 pages, is it on full screen?
Oh, let's go back. How about now?
Right now, we're just seeing you.
All right, let me try this one more time.
Okay. If not, it's not big of a deal. Okay, now, yep.
Now you see it?
Yes, I believe so. Yep, you're good.
It should say back to school preparation.
Yep.
All right. I'm so sorry about that, guys. So this was the first slide. And here's the second slide with the sports. And you're able to see this screen with the sports?
Yes.
All right.
All right.
So,
carry on. Thank you.
all right. Thank you. And then, going on further, we get a lot of questions about, when should we be concerned? I think that one of the difficult things about COVID is there are so many different symptoms that, can just, that overlap with, the common cold, different symptoms where, like fever, for example, fever was around before COVID-19. A runny nose was around before COVID-19. Headaches were around before COVID-19. So it's hard to differentiate just based on symptoms alone to say, hey, does my kid have COVID? Should I be concerned? So some of the things to look out for in terms of when to be concerned, high fevers, are pretty important. If a kid has a temperature of, 103, 104, that's certainly something that you should be calling your doctor for to have your kid evaluated. Not just a cough, but when your kid starts developing a persistent cough, or shortness of breath, difficulty breathing, that's something to seek medical care for. One of the symptoms that we've seen with COVID also is diarrhea. I'm not saying if your kid has one episode to go run to your doctor, but again, multiple episodes of diarrhea, your kid is having nausea, vomiting, that's another sign to be mindful of. In terms of, when to be concerned also, your kid may not just have one of them. You may have a kid that has, fever and diarrhea, or, cough, shortness of breath, and a headache. I think it's important to, try not to just, stay home and, give your kid Tylenol and see if it passes. It's always good to seek advice. A lot of offices now, pediatricians, family doctors, they have virtual appointments. So your kid that's home sick with a fever, it could be a simple phone call to your doctor's office to say, hey, my kid has this symptom or that symptom. What should I do? There are times when I am able to advise certainly, certain patients over the phone to say, hey, all you need to do is this and this, and check back with us again later today or tomorrow morning, and let's see how things are going. Or, I don't think it's safe to come into the office today with those symptoms. Let's set up a virtual appointment and let me, see your kid through the phone or the computer screen to see if we can make a decision on what to do. In terms of when to go to the ER, if you should be going to the ER, I think there's been a lot of concerns and a lot of fears about whether or not the emergency room is safe. I think it's good to know that, yes, it is safe to go to the emergency room. It is safe to go to your doctor's office. In all these places, a lot of measures have been put in place to continue to practice social distancing, to continue to keep the spread of germs and viruses and bacterial, at a very low level. Everyone is asked to wear a mask. You have to use the hand sanitizers right before you come in, and also the pediatric offices. For example, at our office, when you get to the office, you have to call to let us know when you get there. And then we let you know if it's safe for you to come in just yet, because we don't want families congregating in the waiting rooms. We want to try as much as possible to limit contact between different families and different patients, and temperatures of parents are checked before coming in, to the offices. Also at the hospital, your temperature is going to be checked before going in. And I think it's very important because you don't want to deal with, a situation that requires emergent care, and out of fear of going to the hospital, you're staying at home, when your kid should be. Something as simple as an abdominal pain, could be an appendicitis, that requires emergent care. So I think it's very, very important for me to share with everyone that, yes, it is safe to go to your doctor's office. Yes, it is safe to go to, the emergency room, for various care, but it's, again, important to make sure you call your doctor's office for whatever symptoms, your child may be having, to see how they can direct you. And they can make that decision for you if it's something that can be done virtually. If you're not comfortable going to the doctor's office, you can also make that request to say, hey, can I just have a virtual visit with the doctor as opposed to coming in? And if the doctor feels like you need to come in, that decision will be made at that time. And then also in terms of where can one go for a COVID test, a lot of urgent cares, the Hackensack Meridian Health urgent cares, all the urgent cares have the capability of doing the COVID testing. I know certain family doctors and certainly pediatric offices have the ability as well. And obviously in the hospitals also, they're able to do that. So I think it's up to you to kind of make that phone call first to say, hey, I want to get my kid tested. And it's not all the times that, that request may be met, because if I were to hear your symptoms, I might say, hey, why don't we see him first? That may just be, an ear infection. Well, let's do a virtual visit first to see even if you need that COVID-19 test. Another thing that I think is very important is, let's not forget what we were doing before COVID-19 started in terms of, doing the yearly physicals or health maintenance checkups. I think the biggest fight against COVID-19 is a good immune system, and with our kids, making sure we maintain those healthy habits, making sure we maintain our yearly checkups is important, to attaining that goal. Having your regular doctor checkups, for the older kids, it's a yearly checkup. For the younger kids, it may be, every 2 months or every 6 months, whatever the case may be in terms of the age group your children fall into. I think it's important to have those yearly physicals. So, they're Physical exams can be done, lung exam, heart exams, routine blood work if necessary, can be done at that time, just so you know that your kid is at least healthy, and has a clean bill of health, before sending them off to school and things of that nature. Vaccines are also important to make sure we're up to date with our vaccinations. With everyone staying at home and people, missing various health checkups, there's been a pretty large lapse, in terms of kids getting vaccinated and things of that sort. So the hope is that hopefully, during this time, we're not seeing in the near future some of these diseases that we're vaccinating against come back, because, people fail to get vaccinated. So I think it's important to make sure we're getting our vaccines up to date. Something that is extremely, extremely important during this time is mental health. A lot of kids are anxious. Even parents are anxious. It's, the fear of the unknown. You may be scared that you're sending your kid to school. You may be scared that you're keeping your kid at home. Your kid may be scared to go to school or even stay at home. So I think it's important to attack those fears head on. I think it's, you want to sit your kid down and talk to them and find out if they're anxious and find out what they're anxious about or what they're scared about and address those concerns. I think one thing as parents, what we need to learn and understand is we have to be open and be truthful to our kids. It doesn't help to paint an unrealistic picture. It helps them understand what's going on in the world, but you also want to break it down at their developmental level. For the younger ones, you may say, hey, look, we're all wearing a mask because we don't want to, share our germs. We don't want to get sick, from getting any germs that are out there. For the older adults, you may be able to have a more mature conversation in terms of saying, hey, like, we have to flatten the curve. We have to do our part in society to make sure, this virus doesn't get worse, and we can keep it, at a low level where it should be. Another thing that I think is important to make kids, the younger ones especially, feel comfortable is make them a part of the decision-making process. For example, like picking a mask. There are a lot of, Disney princess masks out there, superhero masks out there. Make it fun for them. Let them pick what colors they want, what kinds they want. I think Crayola actually made one with different colors for different days of the week. So I think it's important to get them involved, and that helps decrease their anxiety levels and their fear somewhat. And you want to check in on them constantly to make sure that a kid who is excited about going to school now is not sad or upset or scared because of maybe what they met at school is not what they expected. Or a kid that was excited to stay at home to do virtual learning now is not sad or upset because they're missing out on seeing their friends or going to school. So you certainly want to keep on top of their mental health and their emotional status, and try to address it on their developmental level. And again, it's very important to be truthful and honest with them. In terms of various tips to stay healthy, these are things that we've been hearing about day in and day out, on the news and, at different stores when you go to it. It's very, very important, obviously, to keep a mask on whenever you're in public spaces, when you're going to school. And it's also important to avoid touching your face. Our hands, touch different surfaces. We're opening doorknobs and things like that. So we want to encourage your children that, hey, when you go to school, make sure you're not touching your face and, constantly adjusting your mask. So it's important to get a mask that fits well on your child, so that they keep their hands away from their face. They're not constantly, adjusting their mask. Obviously, hand washing and sanitizing your hands is something you want to do with your child at home before they go to school. So, you see how they're doing it and make sure they're doing it right. Again, seasonal allergy meds, the fall season, winter season, that's around the time where you see a lot of the allergies kicking up. You don't want a situation where your kid starts sniffling in school and based on whatever rules they have in the school your kid goes to, gets sent home because they have a runny nose. So you want to make sure they're taking their allergy meds ahead of time so that those symptoms are curbed early on, and we're not dealing with, issues and having to go to a doctor's visits just to, deal with allergic symptoms. Um, Eating regular meals, I think, is very important. One thing we found out over this past few months is a lot of healthy eating habits kind of went out the window because a lot of kids were staying at home, and exercising and going out and playing wasn't something that was happening as often. So, snacking went up, just eating random things went up. So I think it's important to try to get back to a regular healthy eating habits, whether you're staying at home or going to school. More so for virtual learning, because you're at home, you can just open the pantry and grab a bag of potato chips and, eat. You may not have that opportunity while you're at school. So I think it's important that we foster a healthy eating environment. If we're going virtual, I think some schools are not having, lunches at school where you're going to have to pack a lunch for for your child. So again, it's important that we choose healthy options, and avoid, unhealthy snacking, sugary drinks and things of that sort, just to make sure we're, keeping that clean bill of health as we try to navigate this pandemic. Exercise is something that we may have to get creative doing. A lot of schools have either limited gym time or canceled gym time altogether, or canceled recess altogether. For your kid that's going to school, if that's available, that's great. But if it's not available or you're doing the virtual learning, we have to make sure we don't altogether just give up on being physically active. A lot of parks are open where social distancing measures are being enforced. You can go to a park, riding your bicycle around, or, in a safe environment, making sure your kids are wearing their helmet. You can do, online exercises where you guys are standing in front of the TV screen and doing, I don't know, jumping jacks, stretching, different things like that. But try to get creative with your kids and make sure you try to get involved with some sort of physical activity, again, just to try to maintain healthy lifestyle during this time. And I talked about this before, just in terms of checking in emotionally with your kids. You want to make sure you're checking in on them and on yourself, to make sure sometimes your anxieties may transfer over to your kids. So make sure you take care of yourself as parents, and checking in your kids as well, and try to address whatever fears or concerns they have. Um, in terms of virtual learning, there's going to be a lot of sitting down in front of a screen. You know, it's very, very, very important that we practice what it's called eye health. You don't want your kid sitting in front of a computer for 2, 3, 4 hours without taking a break, and then virtual learning leads to eye issues and having to wear glasses and different things like that. So you want to make sure that your child is at least an arm's length away from the screen, and that their face is not glued to the computer screen. There's something called the 20-20-20 rule, which basically is every 20 minutes, have your child look away from the computer screen for at least 20 seconds at something that is 20 feet away. Obviously, I don't, you don't need to measure an object that's 20 feet away. I think that the take-home message from that is, take regular breaks, where your kid is not staring at the screen. Every 20 to 30 minutes, have your kid step away from the computer, maybe even if just close your eyes just for a couple of minutes, just to give your eyes a break before you, come back to staring at that screen again. There are a lot of blue light filters that help decrease the strain in your kid's eye as well, from the brightness of the screen. Something that's important also is make sure the font size is large enough so that your kid is not straining, to see. So these are all things that we should try to address prior to school starting, just so we maintain good visual health for our children. And the flu vaccine, a lot of excuse me, a lot of doctors' offices already have it in stock. So it's very important to get our flu vaccines. You can start getting it now. It's never too early to get it. So I think right before, if your doctor has it, call your doctor's offices, see if they have it, and schedule an appointment to make sure your kids get their flu vaccine. And here are some of the questions that we got prior to this um, webinar today. I'll just try to answer them to the best of my ability. What are questions I should be asking the school my child attends? Again, most families have already made the decision whether or not you're sending your kids to school or keeping them at home. But some important questions is, one of the most important ones I think is what happens if, you know, there is a positive case in school. What happens is, does the school get shut down for 2 weeks? If the positive case is in a class that my child was in, you know, does my child have to quarantine for 2 weeks? Do I need to get my child tested for COVID before having them come back? What safety precautions do you have in place? Is my child going to be able to go to the bathroom 2 or 3 times? Are they going to, be able to have mask breaks? Are they going to have to keep the mask on for 4 or 5 hours? Or are there going to be times when they can take it off, just to get a break from putting the mask on their face? So I think having those questions answered, again, puts you in a better position to prepare your child and help them understand what they're going to be seeing, when they go to school. In terms of the daily routines, again, you want to start practicing now. Transportation to school, you want to know if you're going to be driving your kids to school or if they're going to be taking the school bus. You want to know what safety measures are in place in the school bus. I've heard it said that the school bus windows, need to be open to help with air circulation. You can do that now, but again, when it's, I don't know, 20 degrees, 10 degrees outside during winter time, are we still going to be keeping the windows, low? What are we going to be doing when the conditions change outside? So these are practical questions that I think having the answers to puts you as a parent in a better position to prepare your child for going back to school. If given the choice, how do I make the selection of online or in-person learning? This is a tough one. I think it's important, again, to know what you want as a parent, what your child wants, and then also have the information of what your school is doing, and then take all of that and come up with a decision that works best for your family. It's often said that kids learn best, when they're in school. That's how we all learn growing up, going to school, getting taught different things, going to different labs where your arts and crafts and drawing and different things like that. That's how we learn. You learn hands-on, you learn writing and workbooks and things of that nature. So it's even though that may be the ideal situation to learn, it may not be the ideal situation for your own specific child or for your family situation to learn during this time. So again, it's not a right or a wrong, it's what works best for your family. So I think you ask your child, do you want to go to school, or would you rather stay home, and learn virtually? And again, this question is for that age appropriate child. That may not be a question you're asking a preschooler or a kindergartner, but I think it's important for the older kids to understand what they want. If the kid is extremely anxious, you're scared about going to school, instead of just saying, okay, we're going to go virtual because you're scared, find out what those anxieties are. Is your kid scared because, they don't want to get sick? Then help them understand that, hey, here are some measures that the school is taking to make sure kids don't get sick. A lot of the fears and anxieties kids have are because they don't know the answers to certain things. So finding out exactly what their anxieties are, you may be able to help alleviate those questions and those concerns, and help make a decision. So I don't think, I want to say, yes, send them to school, or yes, stay at home. Just find out what you want to do as a parent, what makes you feel comfortable, what the kid wants to do, and find out if you're equipped. Do you have good internet in your house? Some parents don't even have that choice. So if you are in a good position and you have a wealth of information to make a good decision, then go ahead and either send them to school or keep them at home. But whatever decision you make sure you have all the right resources and tools in place to make it a safe and healthy decision for your child and yourself as a family. How should parents approach conversations with their children about back to school and resiliency during the pandemic? Again, I think, it's very important to be open, to be honest, and to understand what what your kid knows, find out what information they already know about the pandemic. A lot of times there's a lot of false information that's out online, that's on TV. Find out what your child knows and make sure you correct whatever wrong information they may have, about, the pandemic, and let them know that we're all in this together as a family, that you're there to help them know that they're, even if they're going to school, like there are resources available to help with whatever questions or concerns they may have. And if they're staying at home, that you're going to be there for them, to help them through the process and help navigate whatever concerns they may have. And again, I think it's important to try to keep a routine. It's hard on kids whenever routines are broken or whenever things are different from a day-to-day basis. So I think it's important to have a routine for your child, whether it's going to school or virtual learning, and try as much as possible to stick to that routine. Have a time when they wake up, have a time when they shower, have a time that's dedicated to virtual learning, or if they're going to school, have a time when they go to school, when they come back. And for the days when they're virtual, again, have that routine set in place and set realistic goals for them. Don't make a situation where you're like, okay, by the end of the school year, I want to be able to do this, or by the end of today, you should be able to do this and not that. Set realistic goals for them and check in on them on a day-to-day basis to see where they are at mentally, physically, emotionally, and try to address whatever changes that may come up along the way. Mask versus face shield. What is the best recommended PPE or personal protective equipment, and what's the best kind of mask for children? Masks are definitely the if we had to choose, you should and you should wear a mask. And you want a mask that fits well. A cloth, face covering is adequate, for your child. But again, one that's comfortable, one that fits very snugly, that you don't have to, your kid is not adjusting, multiple times throughout the day, and uh, the mask protects your nose and your mouth, which are the two primary ways how you can get the disease and also share, the disease, so to speak. But also you can certainly get it through your eyes as well, which is why, people have been encouraged to wear face shields as well. But a face shield by itself certainly does not protect your inhaling and exhaling. So it's important that we certainly have masks on. Can you do a mask and a face shield? That's certainly allowed. But if we had to choose one, I think a mask is very important. And then enforcing that your child is not constantly, touching their face. They're not touching the doorknob and then touching their face. The face shield certainly protects you from, doing that. But I think it's important that we constantly encourage and, educate our children about avoiding hands to face. Is it dangerous to wear a mask for a long time? No, it is not. Surgeons before COVID-19 wear masks for hours, performing surgery. I personally have to wear a mask for, 8 hours a day, when I'm at work. There was a doctor that did an actual test where he put on a mask for a whole day. It's on YouTube somewhere, and posted it just to show that, hey, it is safe to do this. Now, there are certain situations, where it is unsafe to wear a mask. As you've seen it over and over again for children under 2, it's not, you shouldn't be putting a mask, on children that age group. Anyone that doesn't have the physical ability to remove a mask if necessary, shouldn't be wearing a mask. People that have difficulty breathing when they wear a mask shouldn't be wearing a mask. So that's why it's important to have your kids wear a mask now while they're at home and see how they respond to it, see how they do with it. Have them wear it for an hour and 2 hours and 3 hours, or however long they're going to be doing it while they're in school, just to see, how they do with it and to prepare them, for when they're going out and about, and engage in different public atmospheres. How often should masks be cleaned? every day. So I think it's important to have, multiple masks for your children. If they're going 5 days a week or 3 days a week or 2 days a week, or even those that are virtual learning, there are times you may, be going out to do things, so I think it's important to have many masks so that at the end of the day, they bring it home and it's washed, along with their other clothes, and you're not reusing the same mask day in and day out. When is a good time to get the flu shot this year? The flu shots are available. We've already started doing the flu shot at our office. I believe we actually just started this week. So find out if your office has it available, and get it if they have it, or as soon as they have it. I think, certainly this month and rolling into September is a good time to, get updated with your flu shot. And one last question that I think is important to address is find out from the school if you can change your mind along the way. If I decided to send my kid to in-school learning and maybe you're not comfortable with what, is happening in school, or you're not comfortable because your kid is constantly touching his or her face, and you'll rather do virtual, find out if, you can change from in-school to virtual, or perhaps you started virtual and you find out that, in-school learning works best for your child and your family, and you want to switch back. I think it's good to find out from your school district or the school whether or not that option is available, because I think that's, something good to know, because this COVID, it's constantly evolving, it's constantly changing. So if the atmosphere around us is constantly changing, I think as parents and providers, we should also be able to change with whatever the situation may be out there. I think that is it. Thank you for your attention, and I'm going to hand it back.
All right, Dr. Moses, we have a question regarding, is there any extra precautions that a kid who has asthma should take?
Not necessarily. I think the one thing is, there are certain levels of asthma. There are kids that have mild asthma, there are kids that have moderate and severe. If your child is an asthmatic that has to be on daily medicine, whether it's, Pulmicort or some inhaled steroid, where you have to be on a daily medicine, one thing you want to make sure you're doing during this time is not missing your maintenance medications. You want to make sure your child is taking their maintenance asthma medication during this time. And if it's your child that has mild asthma, then maybe just needs a treatment before sports, or needs it if they have symptoms, you want to make sure that their asthma pump is up to date, their asthma inhaler is up to date, the school nurse has one, or if they're one that, self-administers medicine, they have an updated medicine with them. But in terms of wearing a mask, it is safe for children that have asthma to wear a mask, but again, like I said, it's just important to make sure you have your, the kid is taking their maintenance medications, and you have your asthma inhaler or breathing treatments available if needed.
Okay, great. Another question, are there any natural ways to boost your child's immune system?
Yes, natural in terms of, I think that the most important thing is really just lead in a healthy lifestyle. Eating healthy. One of actually the, biggest risk factors, besides diabetes, heart, and kidney issues that was seen with with COVID is was obesity. So certainly making sure we have healthy eating habits and exercising, that's the most natural way, so to speak, to boost, your immune system. Vitamins have been shown. I think you'll read it in a lot of places where they're saying, oh, take zinc, that can help boost your immune system. I think overall, just if you're eating healthy and you have a healthy lifestyle, the benefits of taking, extra vitamins or extra zinc, there's so many mixed studies and research out there where some do show benefits, some doesn't really show benefits. I think the most important thing really is just making sure you enforce healthy eating habits, and lead in an active lifestyle. That's really the best way to protect yourself. And if your kid does have any illnesses or develop any symptoms, it's very important that those get addressed as soon as possible.
Great, thank you. One last question. You mentioned about the screen time and the blue light. Do the blue light blocker glasses have any benefits? Like, should the kids be wearing those? Would those help?
Yeah, so it's the strain on the eyes. I think if you do have the glasses, it's certainly I use it, because I do a lot of work on the computer often, but I have a filter for my computer, just to decrease the amount of glare that comes from the screen. So it does help decrease that glare, and it helps decrease the strain in your child's eye. So it certainly does offer some benefit. Yes.
All right, perfect. Well, I just want to thank you, Doctor. This was very informative and helpful. And thank you all who joined us today. Please watch your email for an evaluation of the program, a recording of the webinar if you'd like to listen again or share it with others. And we have additional webinars coming up, so please make sure to visit our website at hackensackmeridian.org. And enjoy your day. Good luck to everyone with back to school, and please stay safe.
Thank you, everyone.